Hi, my name is Greg Fell. I'm Director of Public Health in Sheffield. A short video about Christmas. Christmas is coming, we've all noticed. It's a time when we all want to get together. I'll start by saying we're in a very difficult place, epidemiologically speaking. We're definitely not in a safe place. We're in a space where the baseline level of infection is much too high for comfort. So whilst it's coming down, it's still quite high. However, Christmas is coming. The Prime Minister announced a few weeks ago that up to 3 households can come together for 5 days starting on the 23rd of December. That does leave us with risks, and each of us will need to weigh up how we assess and how we manage those risks in deciding how we celebrate Christmas. The bubbles of the 3 households needs to be fixed, most importantly. However you define bubbles, the bottom line remains that the more people you interact with from different households, the more opportunity there is for the virus to spread, and that's always been the case and that will always be the case. So fix your bubbles and keep them fixed. So it's fair to say that many people, having spent 9 months with some form of restrictions on who they can and can't meet with, are reluctant to take further risks. There's no safe way or absolutely safe way for households to come together. But here I'll set out 10 principles that might be worth considering when you're working out how to celebrate Christmas. And just so I'm clear, they're not things that I've made up. This is advice from Sage. There's some very helpful advice from Sage a couple of weeks ago, and this is kind of a paraphrase of the Sage advice. I guess firstly, consider whether in-person interactions are essential. Do you need to meet face-to-face, or can it be postponed or replaced by electronic form of interaction, FaceTime, phones, whatever you choose? Secondly, can you replace indoor with outdoor? It's December, it might be cold, but outdoor is much less risky than indoor from the perspective of the risk of transmission. Thirdly, most transmission occurs due to prolonged close interaction with people you are familiar with in a home environment. We all think if we're going to catch this illness, it will be outside the home from people that we don't know. The converse is actually true. So make sure that the home is well ventilated, and or, as I say, if you can, choose outdoor spaces. Fourthly, take particular care to protect people who are vulnerable to the serious consequences of infection. Grandparents, people who are pregnant, people with long-term health conditions. There are some groups who are particularly vulnerable to very severe illness, and obviously we need to take particular care about protecting those who are vulnerable, and that's been a key part of our strategy in Sheffield throughout. Fifthly, there are people who will be emotionally vulnerable at this time of year. It's always a difficult time of year, particularly for people who are lonely, so we all need to provide whatever support we can to those who will be emotionally vulnerable at this time of year. At six, it goes without saying, but I'm going to say it. If you have symptoms, you've been asked to self-isolate or quarantine, you shouldn't have any in-person social interactions. You know, the advice is stay at home, and stay at home means stay at home, and it doesn't mean go and mix with other people or have other people to your house to mix with. The most important thing to reduce transmission to others, and that transmission may end up in serious illness. So we all need to continue to play our part there. 7, limit your interactions to the same group of people. So this is the point about extended versus tight bubbles. Keep the bubbles really as tight as you possibly can and stick to with the 3 households and keep that really strict. The more people that you interact with, the more opportunity there is for the virus to accelerate into new groups. Limit, if possible, the time spent together is the 8th piece of advice, especially if indoors. 9, manage the home environment and how people interact together. High touch points such as lights, door handles, clean them regularly. Use hand gel in your home to keep your hands. We all know one of the key methods to transmit the virus is you touch something that has the virus on it, you put your hand to your mouth, and that becomes transmission. So you can use hand gel to reduce that risk quite well there. 10, and lastly, communicate all of that well before Christmas. Don't wait until the 23rd or the 24th. So essentially, see as few people as possible for a shorter period of time. Think long and hard about how you want to plan that, and we'll all have different variations of how we plan that. The best way to celebrate Christmas during a global pandemic of an infectious disease is virtually. And we all accept that we will want to meet face to face. There's no safe way to do that, so we are in the business of managing and mitigating those risks as best we possibly can. So hopefully the 10 points will provide some food for thought there. I'll end with the quote I heard, again it's from Sage. A large number of people taking one small risk will have much bigger negative impact on the overall rate of viral transmission and incidence than a tiny number of people taking really big risk. If you look at how that plays out across the whole population, so if we all change our behaviour, we can all reduce the risk, and that it remains the ask. But do have a good Christmas, but have a safe Christmas.